Absolutely. I'm Kim, and I'm a registered dietitian, so I've kind of been into health, most of my life. And I just began to realize in my 40s that I was starting to slow down a little bit. Like Jim just mentioned, we have 3 children. They're all grown now, and I just felt like I was chasing my tail, And I started researching. I did a lot of reading, and we came across bioidentical hormone replacement therapy. And it's been a godsend for us. It really did change our lives, give us more energy, just help us to be more energetic, feel better in all areas of our life.
Great. So Kim, tell me, what has your experience been with BHRT and what symptoms have improved?
Well, the experience is it's really easy to do. It's not a complicated procedure, and we can talk about that in a minute if you want. What has improved is a multitude of things. I used to get up and it would hurt. My feet would hurt, my joints would hurt, I would ache, and I can tell once I get my pellets and I'm, in the peak of them, I don't ache anymore. When I exercise, it used to be hard. I had to push myself to exercise. When I'm on the pellet therapy, I can run if I want, which, I'm not a young chicken anymore. I'm getting up there in years, so to be able to do that, that is a big benefit. So I have more energy, I don't ache. I didn't really go through menopause because I started this prior to menopause because I knew menopause was coming, and that was amazing. All I had was just a little bit of night sweats, but I never had the bad hormonal hot flashes or sweats, and if you've got them, I know these will help, but if you start just right prior to it, you can literally avoid the whole process. The energy level is greater. I think it makes your skin look a little bit younger. As you can tell, I'm really a proponent of these. I think they've helped in all aspects of our life.
All right, so obviously this is a medical procedure. We are making an incision in the skin, and I know that can make some people a little wary about pain and not sure what to expect. So can you guys tell us, what is the procedure like? How did you perceive it as a patient?
It's really no big deal. You come in, you guys put a little numbing cream on there, and then it's just a short pinch, kind of like maybe when you go to the dentist and they say pinch is coming. I always think of the same thing. I'm getting a little pinch, stings for just a minute. Procedure, you don't even know it's happening because it's numb, and then you go home. You'll have some soreness in that area for me as a woman. I would say a couple days. I can just feel it's a little bit sore back there, but you just avoid any exercises that involve your glutes or anything in that area for a couple days. Don't go swimming for a couple days, and then you're good to go. It heals up really quickly in a woman. I think men have about a 7-day period where you don't really do any heavy exercise.
So for people who are similar to you and maybe considering hormone replacement therapy, what advice would you give them?
I would say resoundingly do it. It's going to change the whole way you look at life and how you feel about life. We've referred countless friends to bioidentical hormone therapy, and I feel really blessed to be in a city where we've got doctors like you who are here to help us. But when we started, once we realized the benefits of this therapy, we were driving 5 hours. 5 hours we would drive from our home, because we found we were particular in who we worked with, and when we found a physician that we related to and had a good rapport with, we drove 5 hours. So we did that 4 times a year, 3 to 4 times a year, to get the pellets.
I would say that you're probably doing exactly what you need to be doing. You're doing your research and finding someone that you can have confidence in and learn from as you begin this journey. It is part of taking care of your health. So step 1 is, who'd you get your recommendation from? Who did they recommend? And it is nice having local providers that we can work with. We did drive a lot as we began our journey. This is becoming a lot more mainstream than it has. Most people never heard of this when we mention it. So get a good solid referral from somebody you trust, and do a little bit of research, and then build a relationship with them, because it is part of being healthy and taking care of yourself for the long term.
I've given, there's several books written about this, and I've given that to some of my friends when they're trying to decide whether this is something they would want to do as well.
So you guys mentioned driving 5 hours and going to providers. You've seen multiple providers over the years. So if people are interested in hormone replacement therapy, what do you recommend that they look for in a provider that they're going to choose?
I tend to look for providers that are knowledgeable in bioidentical hormone replacement therapy, but also in other aspects. I like them to be involved in the supplements that I'm using and be aware of how those also affect your whole body. I don't want someone like, I won't say any name, but we went to one provider once and it was just this little room and we went in and he didn't really interact with us at all, and then the pellets were in and I felt like we were just, you know, being pushed through. It wasn't the whole picture. I want someone who's involved in this aspect of our life to look at our whole being and what we're doing, not just, okay, here's your pellets, now leave.